Are regional nerve stimulation devices effective for headache treatment? Have you ever wondered if there is a device that can help ease your headache pain? Today, we are going to talk about regional nerve stimulation devices and their effectiveness in treating headaches. These devices, which include peripheral nerve stimulation and occipital nerve stimulation, have been gaining attention for their potential benefits. Peripheral nerve stimulation involves sending electrical signals to nerves outside the brain and spinal cord. This can include the occipital nerve at the back of the head or other nerves on the forehead. Occipital nerve stimulation specifically targets the occipital nerves, which can help with pain that starts in the back of the head and moves forward. There are non-invasive options available. These devices use electrodes placed on the head to deliver stimulation without the need for surgery. On the other hand, there are also implantable devices that requiring a surgical procedure to place leads and a pulse generator. This allows for continuous or on-demand stimulation. So, how effective are these devices? Clinical trials have shown that non-invasive nerve stimulation devices can provide significant pain relief during acute migraine attacks. Some patients even report complete pain relief within 2 hours of treatment. Long-term use of these devices has also shown benefits in reducing the frequency and severity of headaches. Many users find relief without needing medication. For those with chronic migraines or cluster headaches, implantable occipital nerve stimulation has shown promise. Studies indicate that about 40% of patients experience sustained improvement for several years after the procedure. However, success rates can vary based on the type of headache and how well the stimulation targets the pain area. Devices that create sensory stimulation in the same area as the headache tend to work better. Safety is another important factor. Non-invasive devices generally have a low risk of side effects, often limited to mild sensations on the skin. Implantable devices do carry some risks associated with surgery, like lead migration or infection. However, newer designs for peripheral nerve stimulation have reduced these complications. These devices can be used for both treating acute migraine attacks and as preventive measures to lower headache frequency. They are particularly useful for individuals who cannot tolerate medications, are pregnant, or prefer non-drug options. Physicians carefully select patients based on headache type and previous treatment responses to ensure the best outcomes. In summary, regional nerve stimulation devices offer effective treatment options for certain headache disorders, especially chronic migraines and cluster headaches. Their success relies on selecting the right patients, targeting the correct nerves, and choosing the appropriate device type. While they may not work for everyone, they provide a helpful alternative for those seeking relief from headache pain.